Good evening, my people. It's been a while here. I missed you guys. Good evening, good evening, good evening, good evening, good evening. How was your day? Happy New Week. Good evening, good evening. How was your day? Some people may still be on their way home. I pray that the Lord will take you home safely. So this night, I want to talk about infections during pregnancy, protecting yourself and your baby. Very important topic. Infections during pregnancy, protecting yourself and your baby. It is very important. This topic is very important, honestly, because there are so many things that people take for granted and that could lead to fatal complications like anemia, could lead to premature delivery, could lead to stillborn. So many things that this infection can cause if you don't take care of yourself. And I always say that anytime you feel of you are pregnant and what you are feeling is not normal, please always go to the hospital in time to see your doctor or your midwife. Is very, very important, because you are carrying a life, you are carrying a destiny, you are carrying a nation. So you need to watch it. You need to listen to your body and see the doctor quickly for quick intervention. Don't wait until complications set in before you go and see your doctor. So just like I said, I'll be talking about infection during pregnancy, protecting yourself and your baby. So my beautiful gorgeous mama, tonight, just like I said, I want to talk about something that every pregnant woman needs to understand. Infections. They may seem small, but they can silently affect both you and your baby if not treated early. Yes, you may think it's small and you ignore it. You are having the sign, you are ignoring it. It could be very serious if not treated early, and this can affect you that you are carrying the pregnancy and your unborn child, which you will not like. So I want to ask, have you ever had UTI while pregnant? You can drop your answer in the comment section. When you are pregnant, can you remember maybe you had urinary UTI? Means urinary tract infection, and this is very common during pregnancy. So what are some ways you keep yourself clean and safe during pregnancy? You can drop that in the comment section. Anytime you come across this video, do justice to it, to listen, watch it to the end, because it's very exciting. Carrying a baby, a pregnancy, is a gift from God, and you, as the incubator that the Lord is using, you need to take care of you, yourself, and that baby, because whatever you eat, whatever you do, will affect that unborn baby. So you need to watch it very well. If you are not feeling fine, don't stay until things get worse before you go to the hospital. You need to see your doctor ASAP, so that things will be treated and you will be fine. So what are the common infections to watch out for? We have, just like I said, we have the urinary tract infections caused by bacteria entering the urinary system. And the symptoms include burning sensation while peeing, frequent urination, cloudy urine, and lower abdominal pain. These are the signs that you will see. And these are the signs that you will see, that you will know that you need to go to the hospital. When you have a urinary tract infection in pregnancy, when you are peeing, you will be feeling, a burning sensation when you go to urinate. And this is not a normal sign. It's a sign that you have urinary tract infection during pregnancy, and you'll be having frequent urination. You have cloudy urine. You will see the color of your urine will not be clear. It will be somehow cloudy, and you always complain of abdominal pain. And the complication that can occur if not treated are, it could lead to kidney infection or preterm labor. Honestly, it could cause all these things. Then how do you prevent this? You drink a lot of water. Make sure you hydrate very well, at least 8 glasses of cup every day. It's for you and that your unborn baby. You need to take a lot of water. You need to hydrate yourself very well. Which message? Let me see. Some people, when they come to somebody's life, the comment they will be dropping, honestly, you will just feel that what is wrong with people? Why? Let me just hide it. Hello, good evening. How are you? How was your day? I'm fine, thank you. Where are you watching from? Can you tell me where you are watching from? Thank you for coming to my live stream. Where are you watching from? Buwanezua Mishra. Are you Indian? Thank you. God bless you. So, as I was saying, how do you prevent this urinary tract infection during pregnancy? Is by taking a lot of water, at least 8 glasses per day. Then you don't have to, when you are feeling to pee, you are feeling to urinate, please don't hold it. As soon as you feel that, go to the toilet and pee. You know, when the uterus is growing, the pressure on the bladder will make you naturally, to be peeing every now and then. But this one now, you are having the urge, and for you to prevent it is for you to always pee as anytime you are feeling to pee. Okay, you are from it. I'm from Nigeria. I'm in Lagos, Nigeria. Thank you. Thank you for coming. God bless you. Please, can you help me to like this live stream? Help me to like it. Thank you, Mishra. So, then you, as a woman, if you go to use the toilet, you want to wipe yourself when you're intimate, your VJ, you have to wipe from the upper part to the lower part. Because because of the proximity of the anus to the VJ, you have to wipe from the upper part to the lower part. Because if you wipe from the lower part to upper, you can introduce bacterial infection into your VJ, and this could travel to your urinary tract infection, to your urinary tract, and this could cause infection. So you have to be very careful. Thank you. God bless you. Then make sure you wear breathable cotton underwear. Wear cotton underwear, not the one that will be very tight. We used to tell even men that they should not wear tight boxers, because this could affect the sperm. So wear a boxer that is very loose, that you'll be you'll be very free. So as a woman, also wear a breathable cotton underwear. Then we also have vaginal infections, yeast and bacterial vaginosis. This is also very common during pregnancy. It is caused by hormonal changes that disturb the VJ balance. Naturally, we women, we have some some things that protect our VJ, and this could be disturbed during pregnancy due to hormonal changes. And what are the signs? You could be having itching, you could be having unusual discharge, either white, yellowish, or with odor, with offensive odor. Even you'll be perceiving that odor. So you have to make sure that you go to the hospital when you have all these signs. Please don't stay at home and say it's normal now. During pregnancy we have all these things. Please, because of the child that is growing in you, you need to go and see your doctor immediately for you to be placed on treatment. Then how do you prevent all these things? Thank you, Milo Tooth. Oh, thank you. Mishra, thank you. God bless you. So how to avoid this is you avoid dutching, because it kills, just like I was trying to remember that our VJ has some natural bacteria, some healthy bacteria. By dutching, you are killing those bacteria because they are there for a purpose. You see some people saying, I want to dutch, I want to wash inside. No, ordinary water is okay. You don't have to introduce anything into your VJ. Please be very careful. And you have to keep your VJ very clean and dry. When you go to the toilet, even if you use water, you can have your own small towel, or you use tissue and pat dry very well, so that that place will always be clean and dry. And make sure that when you're having these discharges, you always changes your panties at least twice in a day. You can even use pants liner. Make sure you are very clean as a woman. It is very good. Then you have to report symptoms early. Don't do self-medication. Don't just go to the pharmacy on your own and and you are pregnant and you just go and buy drugs. Maybe somebody told you that I used to have it when I was pregnant, then you now go and buy the same medicine. No, please don't do that. Because of your unborn child, you have to protect it. You have to make sure that child is safe. Don't just take any medications anyhow. So you have to report symptoms early. Go to the hospital, go and see your midwife or your doctor, so that you will be given a medication that you are supposed to take. Then malaria is very common in Africa. I live in Africa, and is one of our very common infection, especially in Africa and tropical regions, and is one of the most dangerous infection during pregnancy. Malaria, very, very dangerous, and could bring a lot of complications if not well taken care of. And the risk could be miscarriage, anemia, or stillbirth. Yes, malaria can cause, because you'll be running temperature, and if it can also make you to have anemia. So you have to be very careful. So how do you protect yourself from having malaria during pregnancy? Is by sleeping. Okay, thank you. You are going. All right, thank you, Mishra. Take care of yourself. Enjoy India. One day you come to Nigeria. Thank you so much. God bless you. So you sleep under treated mosquito net. Sometimes when you go to antenatal clinic, they can give you mosquito nets. This will help to, especially people living in the rural area. They use mosquito net to prevent mosquito bites. But in cities, we have insecticide. Maybe when you are going to work in the morning, make sure you flit everywhere in your house before going to work, so that by the time you come back, the odor would have disseminated, and the whole place, your house will be free of mosquitoes. Then you have to use preventive medication prescribed by your doctor. We have some anti-malaria, some preventive medicine that can be given to you in antenatal. Make sure you take them as it is prescribed. And you have to stay away from stagnant water. Maybe the area you live, your gutter is always full. You tell your husband. The people living, like this our house now, we have about 6 flats. There's a way we contribute money every month to clear our environment. So if you do that in your house too, stagnated water can always be cleared, because these are the things that can attract mosquitoes into your environment. Then the next one is foodborne infections. We have listeriosis and toxoplasmosis. These are caused by eating undercooked meats, unpasteurized milk, or contaminated food. So as the only way you can prevent this is always cook food very well. You want to cook your meat, make sure it's well cooked before eating it, because if not, you can have these foodborne infections. And when you are taking fruit or vegetable, as soon as you come back to the house, please put them under the running water and make sure you wash them very well before eating it, to prevent infection. Then you avoid handling cat litter. If you have cats at all, you have cats and your cat poo everywhere, please avoid handling them, because you are pregnant now. You have to really be careful. Then I think this is the last one is sexually transmitted infection. When I say urinary tract infection, some people will be thinking maybe it is sexually transmitted. No, sexually, STIs is different from UTIs. Just like I said, UTIs mean your urinary tract infection, and this can be caused by wiping yourself from below upward. You can introduce bacteria into your VG and it will go into your urinary tract. But these sexually transmitted infections are something like syphilis, HIV, gonorrhea, and chlamydia. And the risk of this is that the patient can have miscarriage, premature birth, or infection passed to the baby. And the way you can prevent this is, you have to get tested early during pregnancy. That's why when you come to antenatal clinic, we send you to the laboratory to go and do so many tests, so that we'll discover whatever it is and start treatment as early as possible. Any condition that the treatment starts early, complication will be minimal. That's the truth. Don't wait until you are down before going to the hospital. Then use protection if partner status is unknown. If like HIV, you see some couples, they don't, some men will have HIV, they will not tell their wife, some, so the best thing is for you to use, uh protection, especially, and stay with a partner. At least all these things we've had it so many times, that keep don't keep multiple sex partners, and always use protection when you are intimate with a partner. Then you also attend antenatal visit faithfully from 16 weeks. Go and register in the antenatal clinic, and make sure that you attend antenatal clinic regularly. This is very, very important. So why are these infections very risky during pregnancy? Why are they risky? Because it could cause inflammation that can trigger early labor. When your body is very hot, as you are hot, even internally you are hot, this could trigger early labor. Then it can cross the placenta, also affect your baby's growth. That's why when you are pregnant, I always say it when I come online or I do any video, that please go and visit your midwife. You don't have to wait for a second. Anything that you feel that this is not right, please go to the hospital to get diagnosed and start treatment as soon as possible, because it will close the placenta and affect the baby's growth. The baby's growth could be stunted even while still in the utero. And this can also cause brain damage, jaundice, or newborn infections after delivery. If you refuse to treat it at when you are supposed to treat it, these are all the complications you could get. The baby could have brain damage, could have jaundice or newborn infections even after delivery. And this can also make the mother to be very weak, anemic, or dehydrated. So you can see that this infection during pregnancy is not something to joke with. It's not something that, you will just say, let me just go and buy drug at the clinic. It could affect your baby. It could stunt the growth of your baby in the uterus, because whatever you take crosses the placenta to go to the baby. The baby rely on you 100% for its survival. So you have to be very careful. When you are pregnant and you are having all these signs of infection, please go to the hospital in time. Go and see your doctor. And I always say that anytime you go for antenatal clinic, don't be shy. Ask questions. And don't hide anything from your midwife. When she says, is there any problem with you? And most times that we provide, confidential area for you to be able to open up for her. Tell her. Don't pretend and don't say, I don't know what she will feel about it. No. She's a professional nurse. She's there to help you. And she will surely listen to you and do the right thing that you deserve. And, I remember one woman that I once cared for when I was in Kebbi, who ignored a mild fever thinking it was nothing serious. Most women, that's what they do. They say, it's not a big deal, Jare. Is it every time I'll be going to the hospital because I'm sick? Go. It's better. Prevention is better than cure. If it's for you to go, please go, because of your unborn baby and because of yourself. You are the one carrying this child. You too, you need to be well and healthy. You need to be up and doing. You need to live a very good life. Pregnancy is not a disease. Just take care of yourself. Attend the antenatal clinic. If you feel anything, go to the hospital and you will see that everything will be fine. So please stop saying that. So this woman, she didn't come to the hospital in time, and by the time she came, she had a severe infection. But God helped her, because with the early treatment, she and her baby recovered beautifully, and that is why awareness saves lives. If you come across this my video, please watch it. Share it, because it may be useful for somebody. You may say, I'm not married. You will marry one day. You will marry one day and you will need it. And that time you remember that, I once saw one woman on YouTube, she was talking about this thing. I just ignored her. Please, it is very important. So, how can you stay protected from all these infections that I've been talking about? Your daily habit is very important. You have to maintain hygiene. You have to wash your hands before and after eating, or even when you go out and you just came into your house. The first thing you're supposed to do is for you to get a very good soap. Wash your hand under running water. Wash it even under your fingers. Wash it very well before and after eating. Please, it's very important. Change underwear twice if needed. You are having discharges, please change your underwear. We have some party liners in the market. You can also buy it and use it anytime you are going out. Then stay hydrated and eat balanced meals. This is very important. You have to take at least 8 glasses of water in a day. Take balanced diet. Some people will say, where do I have money? Things are very expensive. Yes, we know things are expensive, but there's a way you can do it. Even if it's an egg every day, just one. Vegetable, you can get vegetable of 500 naira. Boil it or steam it and put it on your rice with that egg. And you are good to go. That's the truth. You don't have to be a millionaire for you to eat a well-balanced diet. Now that you are pregnant, you need it very well, and it's very important. Then keep stress low and rest often, because strong immunity fights infection. You need to stay off stress. Keep it low. I know that so many things in this life that can make you to be stressed up. Please don't allow that to overwhelm you, and you need to rest often. Is very important, because your strong immunity can fight infection for you. They will stand like soldiers and say, come in, we will blow you. So it's very important that you rest and keep away stress. So, and the medical care, you have to take all the prescribed vitamins like folic acid and iron, even as you are pregnant. Every time, every day when you go to antenatal clinic, anytime you go, they give you all these medications. Don't just keep it at home. Please endeavor that you take everything. If they say it's for 1 month, please make sure you take it every day, so that everything will work well. Complete all antibiotics. You've gone to the hospital and doctor prescribe antibiotics for you. Make sure you take it accordingly. As at when, if it's 9 a.m. you are taking it, as soon as you take your breakfast, please take it. Don't stop halfway and keep it and say, I will take it later. Make sure you take everything. It is very important. And don't take herbal and street medicines without consulting your doctor. You are pregnant, you are sitting in front of your husband and say, and you just call and be taking, please, because of your unborn child. I am not discrediting any herbal medication, but that is the truth, because all these things have their own side effects. Go and consult with your doctor before anything, and always attend your antenatal appointments as at when due. Don't be skipping your visits. Make sure you attend it as at when due, and adhere to all advices or counseling that your midwife gives to you, and everything will turn out good. So after all this now, when are you to seek help? When to seek help? Immediately. So if you notice anything like this, you have to go to the hospital in time. You are having fever and chills every day. Your body is very hot. You are just doing like, please go to the hospital. And you are peeing, just like I said, you are having burning sensation. The urine is burning fast. It's coming from your ureter. You can feel it. You need to go and see your doctor for investigations and medications. Bad smelling VJ discharges also, you have to go. Persistent abdominal pain and any sudden change in baby's movement. If you are very observant, you know that something is not right with you. If you are pregnant, maybe your baby keeps like 5 to 6 times in a day, and now you barely notice the kicking. Something is wrong. So go to the hospital. You may do scan, you may do laboratory, whatever they ask you to do, please do it for the safety of your unborn child. So I think that is it. So mama, one thing I will tell you is that your body is doing something divine. You are nurturing life. Protect it, and don't be shy to ask questions or seek help. Remember, prevention is love in action. When you prevent that unborn child from complication, it's because you love that child. You're already bonding with that baby. You can feel the kick. You're already hoping that one day I'm going to see his beautiful face. So take care of that child. Protection is love in action. So mamas, just like I said, you are doing something divine. You are carrying a destiny. You are carrying a nation in your womb. So you are nurturing life. Please protect it. Don't be shy to ask questions or seek for help. Remember, prevention is love in action. So I hope you have enjoyed it. Make sure you watch it to the end. And we end with a short prayer that, Lord, I pray for every pregnant woman here. Keep their bodies strong, infection-free, and full of peace. Let every baby grow in perfect health in Jesus' name. So, Mama, you've got this. Stay healthy, stay beautiful, and I'll see you next time. Take care of your beautiful self. Have a wonderful night rest. Bye. Bye. The Fashionable Midwife loves you.